How's it going, familia? Today's recovery class is gonna go over anyone that's got low back pain or sciatic pain, and we're gonna actually kind of highlight the SI joint. So that SI joint is the one that's right between your hips, kind of in that dimpled part of your low back. And what it does is it kind of connects both sides of our hips. And if one side's off, you can feel like a hip's lower or one side's really tight. And this happens a lot of people with, if you drive a lot, say you sit with your wallet in your back pocket, or if you're at a desk all the time and your core turns off and your back starts to, your spine's literally holding you up. Maybe you're leaning towards your mouse more often. If you're shifted one way more than the other, or you're imbalanced, the SI joint can go a little bit out of whack. So what we're gonna do real quick is just show you some stretches, some myofascial release, some strengthening, and then the final one's gonna be an active movement to adjust your SI joint. So we're gonna start with some simple stretches. We're gonna lay down, plant the feet. First thing we wanna do is feel our hips and our core. So what I want you guys to do is find out where that neutral position is. All you gotta do is try to get your low back to literally hit the ground. That's gonna pull your hips out of this arched position, which is what a lot of times we get tight low back pain from this. So we're gonna get the hips down. Once that low back is level, take your ankle, which is gonna be flexed, flexing this ankle, cross it over your knee, and then this opposite knee, I'm just gonna slightly push it away from my body, not crank it out. Just push it enough, actively use muscles. I'm not gonna force my hand down. I'm gonna use my muscle to push my knee down. So this muscle here is pushing my knee down, 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 down. I'm actively stretching. I don't wanna passively push. I'm actively getting this in. So keep pushing here, keep thinking about your low back, pulling your low back down to the ground again, pushing this knee further away from your body. This is the first stretch. Once you get to this position, you feel like you got, all right, a decent stretch, you can relax for a second. Next time I'm doing it, I'm gonna grab either my shin or my hamstring, depending on your range of motion you can grab. And now you're just gonna keep actively pushing away from your body, the muscle, but then grab onto this knee and start to bring your knee up. Take a couple deep breaths and breathe out. I don't think there's any time range I'm gonna give you, but do it for 4 to 5 deep breaths, however long that takes. If you have one side to stretch, great. Maybe you just have to do this one way. If you just wanna have good back health anyway, go ahead and do both sides. But from here, we're gonna take you into the next stretch. So from here, I'm just gonna take both my knees, release out of this, deep breath, and bring them in towards my chest. After a few seconds, straighten out one leg, hovering off the ground, your heels hovering off the ground, the one that's straight. Bring this one back to your chest, and do the other side as well. Always thinking about my low back the whole way through here. After a few reps of those, once you guys feel like you got a good stretch there, we're gonna flip on over to our knees. I wanna start with really close knees. They're pretty much touching, my toes are relaxed back. And now I'm gonna push my head through my arms. And from here, just stay, relax for a second. Take a deep breath and hold this position. And now whatever side is bothering you, you wanna reach to the opposite side. So if it was my right side, I'm gonna go palms down, reaching to my left, and pushing into the ground. And you gotta play with your hand position. I like to take this hand and actually reach it over my other hand, and it gives me a little bit extra of a stretch. Find the angle that targets the part that is tight. So we're gonna move on after those stretches and get going there. We're gonna actually take you to the myofascial release. You can use a tennis ball, a lacrosse ball, a golf ball. Smaller is more precise, bigger is gonna be a little bit more of like a shotgun approach. You're just kind of going through everything. But there's a bunch of spots. We're gonna actually start not on the back, we're gonna go down to the butt. So there's a crest right where that hip bone is in the back, that pelvis bone. I want you guys going, so this is the bone, below it. So I'm gonna be right on the very top of my butt and press in, find a spot. You can roll around a little bit till you feel like that woo feeling. Once you get there, keep that leg straight, take a deep breath, and you're gonna force your leg up, 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 up through that pain. Breathing out and release. And you can retarget another spot and release. If you find the right spot and if you're in the pain, I mean, I'm feeling this too, like your leg might be shaking while you're raising it, but try to control the movement. You might even feel some like a little bit of tingleness going on in that leg. After you go up and down a few times, keep playing with that spot. My favorite spot is actually gonna be on the side angle. So not the glute max, but if you go over to your side, that glute med, I'm gonna go into that one. And now I'm on like a 45-degree angle and I'm raising up through there. If it's too hard to go straight leg, bend the foot or back so the knee's bent, and then you can just do a knee raise instead. Same thing, but different lever. The leverage is a little bit different. After you guys get a few of those, this feels great. Now we're gonna talk about resetting and strengthening. So you can do this on both sides. You can even do your low back and do the same movement. Pin it down to your low back, raise this leg, cross the leg, explore, move it around a little bit. We're all different with what parts are tight, so kind of play with your angles, but it's worth giving it a shot. This next one is like a SI joint reset. This is something that has helped me in the past a lot. I'm gonna use a med ball. You can use a soccer ball, a basketball, anything that you think is gonna fit between your knees and that's hard enough that you can apply pressure to without having it release and like squeeze. So this ball shouldn't do that too much. What we're gonna do first is I'm gonna lay down, actively drive all of my weight into my hip and into my heels. So my toes are up, my heels are down, my low back is down, and I'm pushing my butt into the ground. Take this ball, squeeze it between your knees. So now the force you're applying is two directions. You're applying your knees into each other and down to the ground. What this is gonna do, it's gonna force your legs to use the same exact force, and hopefully it resets the SI joint if it's a little bit off. So I'm gonna lay down, push my low back down, push my butt down, drive my heels down, and while I'm doing all that at the same time, I'm squeezing my ball as tight as I can. I'm trying to pop between my knees. Keep doing this. You're gonna feel a release in your low back. Don't let that happen. You have to keep pushing your back down, down, down. It's a really hard combination to master. Guys, this might take you a few minutes to get down. If you get tired, reset and do it again. But when you apply force through the heels, through your butt, and into your knees, do it until your whole body starts shaking. Like literally put all your force in, and if you have an SI issue, you might feel it kind of do a little slip back into place. But if you apply force the right way, it resets your hips. It feels great. Also, you're just strengthening your abductors. It's a good exercise just to practice daily anyway. After that, you're gonna feel your shins on fire. Hopefully both sides are even. That's a great exercise to get through. When you're done doing that one, we're gonna actually move you into a little bit more of an active movement. You can use your bed, you can use a table, anything you want. I'm just gonna use this box. And what we're gonna do now is it's almost like a adjustment on your own. You might feel like your back crack or something. But what we're gonna do right now is I'm gonna be laying down on the ground or on this table. If it's your right side, what you wanna do is you wanna actually bring yourself over to the opposite way. So if it's on my right side, I'm gonna roll to my right, left side, roll to your left. This might not be long enough for me. Anyway, my right leg is straight. I'm gonna hook my left foot in behind my knee and put my right hand on my knee. From here, I'm applying force down in this knee and taking my opposite shoulder, and I'm gonna twist. So I want this knee going down and this shoulder going back. That separation and that twist might a little bit of a crack, but you're not trying to crack your spine. You're trying to move your hip into place. So try this way. I'm actually gonna use momentum to fall my shoulder blade back while pushing down, reset, push shoulder blade back, knee down. And that side in, do it for you. Switch sides, try it on the other way. Hook that foot in, palm down. My shoulder is coming down. And the reason why, I just did it. The reason why I'm having myself on a height is you want this knee to hang over and help with gravity, really to push yourself down when you rotate. That's a quick little reset. Don't twist and torque. It's about slowly using your muscles to activate that twist. Anyway, that's kind of a few things you can try. If that was too much for you, try it on the ground. You guys can go down here and do the same thing, but remember to anchor your foot in behind your leg, because what that anchoring does is it allows you to push your foot into behind your knee and push your knee into your foot. That counter movement is what helps you guys reset your SI joint. So keep that in mind, go through those exercises, and remember to do this while you're warmed up. If you're cold going into this, it's not gonna feel great. You want blood flow, so feel free to warm up a little bit first. Have a good one.